Hello, everyone. I'm Julie Dime, Vice President of Government Affairs at the Virginia Hospital and Healthcare Association. I'm here this week with an update from the Virginia General Assembly. This week, the House of Delegates and Virginia Senate unveiled their amendments to the state budget. Regarding VHHA budget priorities, both the House and Senate budgets fully fund the Medicaid forecast of roughly $632 million over the biennium. A significant increase in such funding is needed to address projected program needs. The House budget includes language related to hospitals' participation in the supplemental payment program to help enhance reimbursement rate improvement. On maternal health, the Senate budget includes funding to expand remote patient monitoring to pregnant women on Medicaid. The House budget also includes funding for Medicaid presumptive eligibility for pregnant individuals, a prenatal health hub pilot program, a mobile maternal health clinic, and funding to increase Medicaid reimbursement for midwives. Both budgets include Governor Youngkin's proposal to increase funding for graduate medical education slots in psychiatric and OB/GYN specialties. The House budget also includes funding to add Medicaid support for graduate medical education residency slots for anesthesiologists. It also allocates new funding for an early childhood public-private partnership pilot with private employers to create approximately 2,585 slots supported by public and private funding. The next budget deadline is February 12th, when both chambers must complete work on the budget and revenue bills and appoint conferees to negotiate the final compromise plans. Another significant milestone in the process occurring this week when we arrived at crossover day, which is effectively halfway point of the session. The date on the calendar by which bills must clear their chamber of origin to remain active for consideration by the legislature. Reaching those points clarifies which bills are done for the year and which bills still have a chance to become law. The legislature is scheduled to adjourn on February 22nd. That's just 2 more weeks. After that, the governor has a month to review bills, including the budget, sent to his desk. He can allow them to become law without his signature, sign them, offer amendments, or issue vetoes. The General Assembly returns to Richmond in early April for the reconvened session to consider amendments and vetoes by the governor. Throughout that time, VHHA Government Affairs team will be on alert, working to advance policies that support hospitals, health systems, and public health.